Welcome back. We're on location at Ultimate Chiro Care. We're going to meet Dr. Perry Camisa, and we're going to learn firsthand his approach to chiropractic care. Dr. Camisa, tell me how this all began. You have a really interesting story.
Well, I've been in practice for Naperville area for over 20 years, 20 plus years. And probably about maybe 10 years ago, 10, 12 years ago, I injured my back. And so as a chiropractor, that's kind of odd that I'm injuring, I'm trying to treat other patients, and I had a bad back that probably half a dozen times a year I was on my hands and knees. So my quest to help myself started with finding one of the machines that were used, which is whole body vibration and power plate. Brought it home and didn't know how to use it, but opened the manual up and it said contraindications and you can't use the machine if you have these things. Well, the things it said on there was one things that I had. So I threw the manual away and tried to figure out how to use the machine. And that's really how it all began, because from there I saw changes happening in my spine, in my life. And it was probably several months later that I bought one machine for the office. And now you see here we have a dozen machines, and we've trained probably physicians from all over the world for the last 6-7 years on how to use this technology.
This really sets you apart as a chiropractor with the technology you're using and the machines. And I also think because you've had your own journey with your back, I think it makes you able to relate to your patients so much more. Tell me a little bit about how you work with your patients and what makes you different.
Well, I think, if you look around, there's probably a couple hundred chiropractors around here. And so what makes us different? We do a lot of work with Edward Hospital from the physicians from Edward, have been for years. And so when someone comes into our office, we do what is called a structural assessment. We look at their posture, we measure their posture, we look at their x-rays, we take digital x-rays. Everything is measured through a software system, so we know where the vertebrae are relative to each other. It really pinpoints where the injury is. And that's our blueprint. So we call that their structural blueprint. So even though someone comes in with low back pain, if they have 10 patients with the same problem, they're all going to have a different treatment protocol because they're all unique. And then we use the technology to apply it to their individual case.
I think many people think about chiropractors as just getting my back adjusted, and it's so much more for you.
Oh, yeah, I mean, it's funny when I hear stories, even if it's from an MD or if it's from a patient about, chiropractic, and they have this idea that I'm going to jump on someone's back or crack their neck. Well, today we use a piece of equipment that is computerized. It actually senses how the vertebrae moves in real time. And that apprehension that people have about getting their neck adjusted, we don't have that. We use the same instrument that we adjust infants with. And when MDs realize that we're not doing a manual adjustment, it makes them feel a bit more comfortable as well.
We're sitting here in this great space where you've got a lot of technology that really helps your patients, and I think that's wonderful, and we're going to find out a little bit how it works, and you're going to show me, which I think is really neat.
This was developed probably about 10 years ago. It's a REACT machine, and the E in the REACT stands for eccentric training. So this this will simulate you walking down the stair, stepping off a curb. That's our safety factor. The power plate is a very unique piece of equipment because it vibrates. So the vibration is really I don't want to call it the secret, but it's the science behind it.
Okay.
So when we do something on the plate, our body responds with a reflex. And that's really the scientific advantage of using this machine versus anything else, because that reflex causes the muscles to fire at 40 times a second.
Dr. Camisa, what's this machine all about?
So the biodensity unit, and this is one of the key machines that we use for bone strength. It's a short duration, high intensity exercise. All right, so we're going to get you in position there for me, and you're slowly going to stand up for me with your legs. Okay. You see the clock going down?
Yes.
Now it's going to turn right. Now the session would be over. So that's what stimulates bone tissue, spinal stability, dramatically improves the strength of somebody, dramatically. Right.
Great job, thank you.
Thank you.
Tell me what types of different treatments and different conditions that you treat here.
Most of the stuff we see are a lot of chronic conditions, chronic pain, whether it's from a whiplash injury, neck pain, headaches, But I would say probably the majority of people we see are low back issues. And low back is a very complex condition to deal with, and everyone's low back issue is unique.
What I really like is that from that blueprint that you do with your patients off the top, that you can really help map that. And so there's a plan, and I think that gives the patients a lot of comfort on how their treatment's going to progress.
With the initial blueprint, as we call it, whether it's x-rays and posture, over the course of time, we remeasure those. We
Right.
measure everything.
Right.
That's the only way we know we're making progress. And if things aren't changing, we need to change our protocol that they use on the machines. And it's that pre-post examination, the reevaluation, that really sets us apart. That's what doctors come from all over the country to learn what we've actually put together in our protocol of how do you take someone from point A, do a blueprint with them, apply this technology, and then see the changes that you see.
Now you've got something else going on here with this Be Strong for Life. Tell me a little bit about that.
We were the first clinic in the country to have Be Strong for Life. And it really developed out of a result of trial and error. So this is thousands of hours of patients, trial and error of someone has a problem, how do we fix it? And so Be Strong for Life was really developed out of that. And now we've got a very sophisticated system that is, we've worked all the bugs out of it. And now there's almost 30 centers around the country that use our same technology, but it started right here. We like to say it's strength, balance, bone health, and fall prevention in your street clothes. And that can be done in 15 minutes once a week.
It's a nice way to continue to be able to be a part of your patient's life and see them keep strong and fit for life.
We had a lady that couldn't get off the toilet. I mean, that's pretty
Basic.
deconditioned, like a necessity of life. Well, 18 months later, we had her walking up 2 flights of stairs.
That's awesome.
We had another guy come in a wheelchair, and we got him to play golf. And it's not just the chiropractic part, but it's this understanding how the spine works and understanding that he is unique, and what are we going to do to help him different than helping somebody else.
I understand that you are doing a little bit of a research project. Tell me about that.
Out of the protocols that we developed here, we've been able to show improvement in bone mineral density. So we have a research project that's been approved by Edward Hospital IRB, which is a review board. And the study, we have now clinical evidence that our system is improving bone mineral density. We're seeing some very positive changes. And now it gives people an option that are looking for a non-medication, natural way to improve bone mineral density. That's what our system is doing.
Well, you certainly have hit on the right target audience for that. It's so nice to take some time and be out here and learn a lot about it. So,
Thank you.
Thank you. We're going to be right back with more Business Connection.